All right, so power button,
Mm-hmm.
that's step one, right? So for invasive ventilation, you need your neonatal flow sensor.
Mm-hmm.
For CPAP, you do not need a flow sensor at all. You pull that completely off.
Okay.
So we'll go through CPAP first, and then we'll talk about invasive ventilation.
Okay.
So right now it's in adult mode, and you know that because it says adult and peds.
Mm-hmm.
But there is a neonatal flow sensor in it. So you see this flow sensor is light blue,
Mm-hmm.
and it has a smaller port right here.
Oh.
The
Okay.
adults are dark blue. The reusables are dark blue. The disposables are clear. The disposable Neos are pink.
Okay.
So to do CPAP, you need a pressure line. This pressure line comes in your circuit. There's a larger end on it when you pull it out of the circuit bag, and you just cut that off.
Okay.
That's going to go on your blue stem.
Mm-hmm.
This is a pressure line, again, just to monitor pressure. So it does disable some of your alarm functions in that non-invasive. The end of your pressure line, there's a little hole right here. Just push that in, make sure it goes in really good.
Okay.
Now we're going to change our patient type to neonatal. You notice the wrong expiratory valve alarm went away.
Mm-hmm.
And it starts in pressure SIMV. So we're going to have to change that. So go under modes, go in CPAP. So you always want to use in CPAP in neonates. You don't want to use NIV or NIVST. These two are adult or pediatric modes. This is neonatal mode. So in CPAP, nasal CPAP. Confirm. It's going to tell you how to hook everything up. Confirm. The circuit has not been calibrated, so we will calibrate the circuit. Disconnect patient.
Will that have to be done each time when you switch it
Yes.
over?
Yep.
Okay.
Because it starts in that adult mode, so when you turn it on, the machine thinks it's
Adult.
well, when you flip it over to neonatal, it thinks all of this is new, that you just set it up.
Okay.
Circuit's calibrated. So you're on 5 a peep, and you have your oxygen. That's the only two settings you have.
Okay.
And then you get this message, no apnea detection. So using your RAM cannula, remember you're going to lose about 1 cm of pressure to resistance.
Okay.
Just because of how long that RAM is.
Mm-hmm.
So remember, even though you're set at 5,
Mm-hmm.
only about 4 is actually reach in
Oh, okay.
your Neo because of the resistance.
So would you want to set it higher than that, or?
And I would base it off what your patient looks like.
Mm-hmm.
If he's still having retractions, if you have the wrong size cannula, then you're going to notice this pressure is not going to be able to maintain.
Mm-hmm.
Every time that baby kind of takes a breath in, this is going to drop really low, and then you may get some alarms there. So if that happens, check your cannula size, make sure you're plugging up, I think it's at least, 60 or 70% of the air.
Okay.
And that's it.
Can I ask a question?
Yeah.
So, the only thing I was confused about was, do you take the flow sensor off for the CPAP? Then
Yep.
you put that, okay, on the blue
Yep.
one?
Yep.
Okay. Just wanted to make sure.
And then if you're still getting this alarm, like this low pressure alarm, our humidifier is open right now, so we're losing pressure right there. Remember your low O2, if you're getting that, we shouldn't be getting that. Set at 21, so I'm not sure why that's alarming. We can go in and look at that. The alarm is set at 25, that's why it's alarming. The low pressure, it's because we have leaks in our circuit.
Right. Because of it being open and
Yep.
plus, like you say, with no water
Yep.
on there. Okay.
So any questions about the CPAP mode?
No. What do they generally start them off at usually?
And I would start them at 5 or 6. Yeah.
Okay.
Or anywhere in between there. You can do half increments here too. Like 5.5.
FiO2 as well as
Lowest FiO2 to maintain your SpO2. So don't start at 100 and work backwards.
go the other way.
Yeah, start low and work up with
Okay.
kids.
Okay. Do you have to change out the circuit as far as anything different than from the ventilator, or does it all stay the same? The only
All
thing you
stays
do
the
is the
same.
flow sensor is the
Yep.
only thing you change out.
Yep.
Okay.
That's it. So if you're ready to say the kid is now failing, you all decide to intubate. What I would probably do while I get this ready is use the radiant warmer to deliver CPAP while I configure this to
To ventilate.
do invasive ventilation.
Okay.
The radiant warmer, you've used it with the NEOT, right?
Yeah. Yeah.
So literally you set your pressure, just like you would set it on the NEOT, and you connect your RAM cannula to the end of that NEOT.
Oh.
So NEOT stays there, you have your PEEP set at 5, and you just put a RAM cannula in the end of it and put it on your patient. And now you have CPAP delivered through your radiant warmer, and it'll give you time to work on this.
Okay. Okay.
So we'll stand by, pull your pressure line off. Get your flow sensor. With these, remember the blue always points towards your patient.
Get these.
Yes.
And then change your mode. Normal mode for Neos is going to be pressure SIMV. Inspiratory pressure, we're going to go up. So I would probably start at around 20. All of the other stuff is fine. You're probably going to need more than 21%. I would start between 30 and 40.
On a ventilator, yeah.
But I'm going to leave it for 21 right now because we're not plugged in to O2. P-Sync. So if you want to dial in your pressure support, uncheck your P-Sync and you can actually dial in pressure support. So I would turn it less than your pressure control. We're going to calibrate our flow sensor. Just follow the directions.
So that part I haven't mastered. I always have to use that little white thing that comes with it.
It makes it easier. I didn't want to untape it though.
Oh, yeah.
Remember, your heater has two different settings, invasive and non-invasive.
Right, right. Will you use that for the CPAP as well?
Mm-hmm.
Okay. So that's when you would do the non-invasive.
Yep. The toggle between the two, you just press and hold.
No, yeah.
Alright, everything's calibrated. And then you would just start ventilation. The pink triangles are spontaneous breaths.
Mm-hmm.
So if you notice pink triangles there, that's really about it.
Okay.
Adjust your alarms accordingly. After you get your blood gas, you may need to adjust your pressure control, your inspiratory pressure.
So pressure control now at 20 is where you would start with.
That's where I would start with.
It's really.
And
25.
remember, it's going to be,
At 25,
yeah,
yeah.
your
because of
total
peak.
pressure is going to be 25.
Right, with the peak being 5 and,
Yep.
okay. Okay. And then the mode was pressure support,
No,
Or,
pressure control, SIMV.
pressure control, SIMV. So that's what that PSIMV is.
Yep.
Okay. Because I think a lot of people want to do the pressure control without the,
Neos, we're not going to sedate them.
Mhm.
They're normally going to be spontaneously breathing
Mhm.
over your vent.
Right,
It's rare for a Neo to not have respiratory drive.
okay.
I mean, it can happen, and it's
That's not a
generally
good
not
thing.
a good
Yeah.
indication.
No, not a good thing at all, so.
Yeah.
Okay. And start, like you say, with the FiO2
Yep.
at, like 40.
Hey, Mark,
And
you had a question.
We used to have ventilation settings taped to the vent right
Mhm.
here.
Mhm.
You can see we've had multiple
Multiple ones, yeah.
and they are
Gone.
gone. Yeah.
I don't know how to get it taken off, but maybe just come on.
Yeah.
Oh, Marcy had a question about the blender. What's the blender for
Mm.
baby? You know, when you put the Neo-T? She
Yeah.
wanted to know what the blender was.
Because I noticed
for.
in one of the rooms one time that they didn't have a blender, they just had it plugged into the flow meter.
So our labor rooms, obviously NRP, right? We want to start with the lowest FiO2
Mhm.
appropriate for that child to
Mhm.
maintain our SATs. We don't have enough blenders
Mm.
to go in all of our labor rooms. So that's why it's hooked directly to the flow meter.
Mm-hmm. So, but we should try to get a blender in there if we can, is that right?
Yeah, usually what I do is I
If you
take it
have
from the
time,
operation to the back.
But in a labor room,
Mhm.
you're probably not going to have time
Right.
because we don't go to
Mhm.
vaginal deliveries
Mhm.
routinely.
Mhm.
So if you get called to a vaginal delivery, there's a good chance baby's already out and not doing well,
Mhm.
and you need to just head to that room.
Mhm.
Okay, but you can hook it up to just a flow meter then?
Yeah, I mean 10 liters, it'll work on any flow meter.
Yeah, because they have like 7 delivery rooms, so they're not going to have a for all those.
For all the rooms?
Yeah.
So if it's on 10 liters, we're just not bleeding in the air, so it's
Right.
straight oxygen is really the
Yep.
only difference, is
Yep.
what it is.
Yep.
So, which isn't advisable, but in a crunch, that's what we have to do.
It's better than
Nothing.
I would rather have some possible vision problems than
Right.
brain problems.
Right,
So
absolutely, yeah. And what was the other question there too?
The CPAP, did y'all go with CPAP?
Yeah, Yeah, we did CPAP to begin with. And, when you're delivering for like bagging, is it 1, 2, 3, breathe? 1, 2, 3, breathe. It's not 1, 2, breathe. It's 1, 2, 3, breathe, right?
Yep.
Okay.
Yeah.
Yeah, that's what I was trying to tell the nurse. I was like, I think it's breathe 1, 2, 3. That's what it says in the RP.
Mm-hmm. All right. So, okay. Do you have time to go over the Neo T again? So I can get that
Yep.
on there? You sure?
Yep.
Okay.
We'll have to make it fast. I've got PT at 7.